As you go through medical school, you have to decide relatively early on what you're going to do a residency in. And I couldn't make up my mind. And I didn't know what I wanted to do, whether it was surgery or OB. I even thought about doing that for a while. And I migrated to primary care, family practice, out of medical school and did a residency in family medicine. As part of that residency in family medicine, I got a chance to work with several orthopedic surgeons and sports medicine doctors, and decided that that's really what I wanted to do. That was the part of it that I liked best. I'm one of the primary care sports medicine docs here, and what we do is most everything but the surgery. So we'll do the initial evaluation, the injury care, order the testing that needs to be done, physical therapy if that's necessary, injection therapy, and then when they need to see one of our partners who's the orthopedic surgeon, then we set that up and it's sort of all done already for them, so then they can do their part. Just the other day I had a lady who has a bad hip, and she can't walk very well, and her leg, one leg's shorter than the other, she's got pain, she's not functional, she can't do anything active. Well, we needed to get her seen and evaluated, x-rays done, start on a home exercise program. And I said, we need to get you an injection, an ultrasound guided injection in your hip, and then you're gonna need to see the surgeon because you're gonna need your hip replaced. And she says, well, where do I get that done? And I said, right down the hallway. And it's nice to have a continuum of care with services that are available, if not on the same campus, or if not in the same office, on the same campus. And that's a real neat thing for our patients because they don't have to worry about where they're going next. It's already set up for them. We see not just athletes, but we see active people who really are athletes. They just never competed at an organized level, whether they're a golfer or a tennis player or a runner. And when those people get older, things start to break, things start to wear out. Well, then we're the people to see to get them in the right direction. And as I mentioned earlier, the lady I saw was not an athlete that anybody would think of. She was just trying to walk. And she needed, beyond sports medicine care to joint replacement care, and that's all available with our group. We have really a wide range of tools at our disposal, both mechanical, diagnostic, and people tools. By that I mean other clinicians, whether it's a surgeon or a physical therapist, one of my partners who may do some of the things that I don't do. They're all available either here or nearby, where we can get almost all of that done in a week or so if we need to have it done that quickly. They don't have to wait for weeks to get a study done. They have x-rays right away down the hallway from where we are. They can see an orthopedic surgeon down the hallway from where we are. They can get physical therapy 2 floors down on the entry level of our building, and all of that is available to them in really one campus. And that's a real asset to people because they really don't want to go here, there, and everywhere if they don't have to. I think one of the exciting things about Premier Orthopedics is that we're changing and we're not staying where we are. We are always looking for physicians or staff members, whether it's a physical therapist, an athletic trainer, that can add to what we're doing or expand what we're doing. We just added another primary care sports medicine doc, a fellowship trained, who is very well trained in ultrasound guided injections. And they can do a lot of things that used to require a trip down to the hospital, x-ray, something called fluoroscopy, and now that's all done right here in our suite, same floor, same day, and they can have things done that really weren't possible to do 10, 15 years ago. So we're always changing and looking for talent, if you will, that would expand our ability to take care of people's needs.